Hi, I am Dr. JP Silvera from TaylorMade Health and Wellness. And a few days ago, a patient walked into my office and said something I have heard more times than I can count. She said, I feel fine. I just wanted to get checked out to be safe. And then she mentioned, almost as an aside, that she had been in a car accident 3 days earlier. By day three, she could not turn her head to the left without a sharp catch stopping her cold. That is how whiplash works, and most people do not know it until it happens to them. Here is the biology behind it. The moment your car gets hit, your body floods with adrenaline. That adrenaline is doing exactly what it is supposed to do. It is suppressing pain signals. It is keeping you alert. It is getting you out of a dangerous situation. So you step out of the car, you do a quick self assessment, and you genuinely feel okay. A little shaken, maybe a little sore, but okay. Then the adrenaline clears. And over the next 24 to 72 hours, the soft tissue that got strained in that impact starts to react. Inflammation sets in. The muscles around the injured area tighten up as a protective response, and what felt like nothing suddenly feels like a lot. That delay does not mean something went catastrophically wrong. It does not mean you missed a window. It means the body was doing its job in the moment, and now it is telling you something in the clearest language it knows. So, what is actually happening in the spine when someone comes in feeling like that? A spinal joint that has been through trauma, even low speed trauma, can lose its normal range of motion. It gets stuck. And the moment a joint stops moving the way it is designed to move, a few things happen in sequence. The muscles around that joint tighten because the body is trying to stabilize something it perceives as a problem. The nerves that run through and near that joint start to get irritated from the compression and the inflammation. And here is what surprises most people. You feel it in places that seem completely unrelated. Neck stiffness that becomes a headache behind your eyes, mid back tension that starts pulling on your shoulder blade, a joint restriction at the base of your spine that ends up as a dull ache in your hip. The source and the symptom are not always in the same zip code. A chiropractic adjustment is designed to restore motion to that stuck joint. When I do an exam, I'm looking for exactly that, a joint that is not moving normally through its range, and the muscular and neurological pattern that has built up around it. When the exam shows it is the right move, restoring that motion often settles the whole compensatory pattern. The muscles do not need to guard anymore. The nerve irritation starts to quiet down. The referred pain begins to resolve. I want to be specific about that phrase, when the exam shows it is the right move, because not every presentation calls for an adjustment. There are fractures, there are certain disc conditions, there are what we call red flag symptoms, radiating pain with neurological changes, symptoms that suggest vascular involvement, patterns that fall outside what we handle in this office. We screen for those. If something in your history or your exam points to a condition that needs a different kind of care, we will tell you clearly and point you directly toward where you need to go. I would rather you get the right care elsewhere than the wrong care here. Your first visit with us is an exam and a conversation before anything else. You sit down, we go through what happened, we do a thorough assessment, and then we talk about what we found. Nothing happens until you understand what we're looking at and what we are proposing and why. Informed patients make better decisions about their own health, and that starts with a provider who explains what is actually going on rather than just getting you on the table. Now, let me come back to this patient for a second because her case illustrates something worth knowing. She had been debating whether to come in for 3 days. She kept telling herself it would probably go away on its own, and maybe it would have. But she also would have spent those days, and potentially the following weeks, in a restricted, guarded pattern, muscles compensating, movement limited, the whole chain tightening around that stuck joint. The longer a joint restriction sits without being addressed, the more the surrounding tissue adapts to it. You get better at working around the problem until one day you bend down to pick something up off the floor and you genuinely cannot get back up. Coming in early is not overreacting. It is getting information. The exam either confirms there is something worth treating or it tells you that things look structurally sound and gives you confidence that rest and time are the right prescription.